Good evening, I'm Prasad, and this is KiniNews. With the nationwide MCO making a comeback and COVID-19 cases soaring, many have questioned the function of Muhyiddin Yassin's emergency. But there are still people out there defending the move. Past President Abdul Hadi Awang has defended the state of emergency by calling it a proactive action that was necessary to manage the increasingly critical COVID-19 situation in the country. In a statement, he noted that in some countries, the COVID-19 pandemic had gone out of control and they are facing a lack of medical equipment and personnel. He said, therefore, the government took swift action, starting with ensuring sufficient equipment and personnel, including the need to train additional people. Hadi also advocated action against people who he described as disruptors in the battle against COVID-19 and also ensured funding under the emergency. In January, the government declared a state of emergency due to the COVID-19 situation. While a civilian government has been maintained, there haven't been elections nor parliament sessions. In March, the government had invoked its emergency powers in order to tap the consolidated funds and come up with supplementary budgets without parliamentary oversight. Earlier in the same month, the government also granted itself wide powers to deal with fake news about the emergency. On Tuesday, Malaysia had over 38,000 active COVID-19 cases with over 400 patients in the ICU. While Hadi thinks PN has been doing a splendid job managing the pandemic, Anwar Ibrahim begs to differ. Opposition leader Anwar Ibrahim said the government still appeared confused when it came to implementing a proper movement control order to curb the spread of COVID-19 despite having dealt with the health crisis for more than a year. He said those who are suffering due to the lack of a proper response are the people, especially the poor, who are struggling to make ends meet.
Kalau dulu, bulan Mei tahun lalu, kita boleh faham. Ada kita tahu baru, bagilah peluang. Menteri-menteri ini baru nak dapat kendali tugas mereka, uruskan dengan teratur setelah mendapat maklumat. Dah setahun, ada menteri muka pun tak nampak. Kalau yang nampak itu tidak lain daripada propaganda. Unjurannya salah. Yang dibebankan itu adalah rakyat. Rakyat miskin yang susah dalam menghadapi kehidupan.
Anwar also questioned the slow rollout rate of vaccines. He pointed out how the government had promised to administer 75,000 vaccine doses a day, but the actual number is far lower.
Janji 75,000. Sekarang baru 25,000. Jawabnya, oh tak sampai ubat. Kamu janji buat apa? Mengapa janji kalau tahu? Belum pasti. Sebab tu saya tanya daripada awal, biar ada ketelusan. Apakah betul ada vaksin? Apakah betul kosnya itu menusabah? Apakah benar sampai bulan Mac atau April atau Mei? Semua tak dijawab. Dan minta rakyat supaya diperbodohkan. Alhamdulillah saya bagi tahu, kesedaran rakyat sekarang meningkat.
Commenting on a separate matter, Anwar also condemned the airstrikes conducted by Israel in Gaza during the Muslim holy month of Ramadan.
Condemn the airstrikes carried out by the Israeli army against Palestinian people in the Gaza Strip that resulted in the death of at least 22 people, including children, and the injury of many others. The use of disproportionate force violates international law, and the use of military weapons in civilian areas is a heinous act. I offer my support and sympathy to the Palestinian people who continue to face systematic repression, abuse, and the denial of their basic rights.
COVID-19 prevention SOPs apply to everyone. This includes former Prime Ministers. But before we dive any deeper into that, if you'd like to see more content like this, check the link in the description and consider becoming a contributor. Former Prime Minister Dr. Martin Muhamad has apologized for breaching COVID-19 prevention SOPs while distributing aid in his constituency Langkawi last Saturday. The Langkawi MP said he was informed that he did not record his body temperature before entering Surau Tsunami Batu Arang, Kuala Terang Kuah, and as such had breached SOPs. In a statement issued today, Mahathir said it was a mistake and it should not have happened. He also apologized and said he will accept actions under the related laws. Earlier this month, former Prime Minister Najib Abdul Razak was fined 3,000 ringgit for failing to register his presence at restaurant Nasi Ayam Hainan Chimeng in Bukit Bintang, Kuala Lumpur, and also for not scanning his body temperature when entering the premise. KPMG may need to fork out millions of ringgit, just like Deloitte over the 1MDB scandal, but we still don't know how much because negotiations are still underway. The Perikatan National Government is currently in the process of negotiating a settlement with auditor KPMG over the 1MDB scandal. Finance Minister Tengku Zafrul Tengku Abdul Aziz confirmed the matter today after Damansara MP Tony Phua questioned why Putrajaya did not go after KPMG, even though Deloitte, another 1MDB auditor, had paid over 300 million ringgit in a settlement for its role in the scandal. Deloitte acted as 1MDB's auditor from 2013 to 2016, while KPMG was the 1MDB auditor from 2010 to 2012. 1MDB had cooked its books to conceal the fact that massive loans it had taken out were misappropriated. Zafrul also revealed that the government had recovered another 1.9 billion ringgit in stolen 1MDB funds. The repatriation of the fund was made possible with the help of the US Justice Department. To date, a total of 16.05 billion ringgit in 1MDB funds have been recovered. Zafrul said the recovered funds would be used to service the debts of 1MDB and its former subsidiary, SRC International Sendirian Berhad. However, 1MDB and SRC International still owe 39.8 billion and 2.57 billion respectively after the repayments with the recovered funds.
Shellfish, red meat, and beer. If you love indulging in these foods, you may end up with high uric acid level in your blood. These foods consist high level of purine, a substance that will eventually break down into uric acid and be excreted through our urine. It is recommended that the amount of dietary purines should be kept between 600 to 1000 milligrams per day. Having too much uric acid in your blood can cause attacks of gout. It can also cause kidney stones and blockage in the kidney. The crystallization of the excessive uric acid in your blood can be eased by reducing purine-rich food to only 100 to 150 milligrams daily, maintaining a healthy lifestyle, and consuming urinary alkalinizer like Ural. It consists of sodium bicarbonate, citric acid, and sodium citrate that increases the urinary pH and solubility of uric acid to prevent crystallization. Best of all, it's lemon-flavored and sugar-free. Ural, effective urinary alkalinizer. Neutralize your uric acid problem now.
At the current rate, the Health DG says Malaysia may record 5,000 cases a day very soon.
A total of 4,765 new COVID-19 cases were reported today. This brings the total number of cases to 453,222. The Klang Valley continues to record the highest daily cases, with Selangor alone recording 2,082 cases, followed by Kuala Lumpur with 540. Meanwhile, Sarawak recorded 405 cases, Johor 348 and Kelantan 297. 5 other states also recorded 3-digit figures, namely Penang, Kedah, Perak, Negeri Sembilan and Melaka. In a Facebook post, Health Ministry Director General Dr. Nur Hisham Abdullah warned that the situation could deteriorate further. He said it could exceed 5,000 cases in the middle of the month during the festive season.
And that is all from me today. For more stories, you can go to KiniTV.com. You can also follow us on Instagram, Twitter, YouTube and Facebook for the latest news updates. If you like to support independent media, do consider subscribing to MalaysiaKini.com. And before we go, from me and the whole team, Selamat Hari Raya Aidilfitri. Kami jumpa lagi minggu depan.